Hello, everybody. Welcome to week 13 of the semester. That means that counting this week, we've only got 3 weeks left in clinic. Hard to believe. Your notes for this week. So most students have finished all of their skill evaluations by now. So now that we have a little bit more time to work with students one-on-one, I'm going to ask that you please work with them more on detecting calculus and removing calculus. A common area I see is that students aren't reaching far enough into the interproximal space or underneath the tissue enough to fully find and remove deposit. So please spend some time working with students, help them with instrument selection and so forth. A couple issues that came up last week had to do with confidentiality and HIPAA. So just a reminder how important, of course, HIPAA is and how important it is to remind students that they need to keep all information confidential. This means that they shouldn't be talking to each other about their patients, even at the end of clinic. They shouldn't be discussing patient care. They shouldn't show each other things on Eaglesoft, and faculty that's true for us as well. We shouldn't show one student another student's images on Eaglesoft or inside a patient's mouth. We want to keep all of that information confidential. So if it's on a computer and a name is visible, we cannot do that. If you have something that you absolutely think another student needs to see, you would need to print that image and then cut the name off and have us scan it, or delete it in the confidential scanner before you showed a student. So just some reminders to please keep all that information protected at all times. I did hear that faculty are getting out late in the evening clinics, sometimes in the afternoon clinics, but it seems like it's happening more so in the evening. So I did put some tips and pointers up for you on the digital newsletter on how to help facilitate that process to ensure that you are leaving on time. So please take a look at that. Medical histories need to be completed in ink by the patient. If you do see one that's been completed in pencil, at least make sure that the patient has checked any yes responses in ink or has signed in ink, or is using ink to write over the pencil. But we're working with students and reminding patients that those need to be done in ink. Pencil is not acceptable. I'm going to ask that you please make sure the students stay in their full clinic uniform, which includes their jacket, until the very end of clinic. They should not take the jacket off until they are ready to walk out and leave for the day. And please keep students busy until the end of clinic as well. So if they've got, 5 minutes because their notes are done and their room's already been disinfected, they can look around and stock or help a classmate, organize their binder. Any of those are acceptable, but congregating and kind of chit-chatting, watching the clock run out is not. So they should be engaged in some type of activity and in their full uniform until it is time to leave for the day. For first year clinics, you're also going to see a change this week in how the students remove trash. Instead of the students walking their individual bags into the infection control room, the CA is now going to be bringing a large trash bag out, collecting the trash from the units, and then walking it out into the hallway. So there's less movement of the trash from the unit to infection control out to the hallway. Now it's just going to go from the units out into the hallway. So you will notice that difference in the first year clinics. Second year clinics are going to just keep doing what they have been doing. That's all that I've got for you this week. I hope you're enjoying the nice weather. If there's anything you need, please do not hesitate.